Hi, everyone. I'm Denise Tran, and I'm a postdoctoral scholar at the Department of Psychiatry and Behavioral Sciences. And I'm incredibly grateful for this opportunity to share with you my work on using a parallel process growth model to examine simultaneous changes in cigarette smoking and depression in veterans over the course of 18 months. So research was supported by funds from NIAAA and the Keck School of Medicine COVID-19 Research Funding Grant, which were both awarded to my mentor, Dr. Eric Peterson. And the content discussed here today is solely my responsibility and does not necessarily represent the views of the funders of this work. So smoking is one of the leading causes of preventable disease and death worldwide. And although smoking rates have declined over the past few decades, it's important to keep in mind that very large disparities in cigarette use remain for certain groups. And so one group of individuals disproportionately affected by the negative effects of smoking are American veterans. And so in fact, current smoking actually is reported by 1 in 5 veterans. And in addition to the high rates of cigarette smoking, veterans also report high rates of depression, which often co-occur with smoking. Despite this, few longitudinal studies have examined associations between depression and smoking, specifically among veterans. And so our first aim was to assess simultaneous changes in cigarette smoking and depression symptoms using a parallel process growth curve modeling approach. And so doing this would allow us to explore, for example, how change in cigarette smoking is associated with change in depression. So I also want to add that veterans often report high rates of stress, alcohol use, and PTSD, which are factors that are known to be associated with cigarette smoking and depression. And so our second aim was to explore how these specific factors influence parallel trajectories in cigarette smoking and depression over time. So this study, as previously shared by my colleague Shadi, this study was part of a larger study which focused on examining behavioral health of young adult veterans outside of the VA. And we were able to recruit 1,230 veterans who completed a brief online survey in February of 2020, 1 month prior to the COVID-19 outbreak in the US. And these participants were later invited to complete 4 follow-up surveys over the course of the pandemic, which spanned a period of 18 months. And I'm happy to also report that this study achieved retention rates of at least 80% at each time point. So in terms of what we measured, cigarette smoking was measured by asking participants to indicate the number of days that they smoked cigarettes in the past 30 days. Depression symptom severity was measured with a patient health questionnaire 8. And our time-varying covariates were stress, alcohol use, and PTSD. Perceived stress actually was measured with a perceived stress scale 10. Alcohol use was measured by asking participants to indicate the number of days that they consumed alcohol in the past 30 days. And PTSD symptom severity was measured with a PTSD checklist 5. And these were all measured at all 5 time points. And we also controlled for time invariant covariates, which were measured at time 1, which were sex, race, and ethnicity. So to accomplish our objectives, we used a parallel process growth modeling approach, and we were especially interested in 1, examining the degree to which changes in smoking frequency and depression symptoms were associated with each other, and 2, testing whether initial frequency of smoking or depression influenced the rate of change in the other. And so another way of thinking of this is we wanted to see where veterans were starting at in their smoking and whether this influenced the trajectory of depression symptoms. And in turn, we also wanted to test whether the level of depression that veterans reported at the start of the study influenced the trajectory of their smoking over the study period. So to address our second aim, our time-varying covariates were introduced into the model next at each time point. And this allowed us to determine the effects of alcohol use, PTSD, and stress on our smoking and depression outcomes over time. So prior to fitting the parallel process models, we estimated latent growth models for depression and cigarette smoking separately. And so denoted by the orange line, you can see that participants started with an average of 14 days of cigarette use in the past 30 days and showed a significant decrease in cigarette smoking over the study period. And this is actually consistent with some of the other studies that I've seen with the general population, showing that smoking rates have generally declined during the pandemic. And then denoted by that second line, the green line, veterans on average started with a score of 7.76 on the PHQ-8, with significant increases in depression over time. And keep in mind, a score of 7 indicates probable mild depression on the PHQ-8. Next, we fit a parallel process growth model, and we found that a higher starting value in cigarette smoking was associated with a steeper increase in depression over time. And we also found that an increase in depression is associated with a less steep decrease in smoking over time. And so although overall smoking decreased over the course of the study, an increase in depression over time was associated with a slower decrease in smoking over time. And these effects did not change with the addition of our time invariant covariates. And so when talking about our time varying covariates, we found that stress resulted in less cigarette smoking at times 1 and 2, but more frequent smoking at times 3 and 5, or 3 through 5. And stress had an increasing effect on smoking frequency over time. Stress also resulted in greater depression at times 1 and 2, but this effect was no longer significant at times 3 or 3 through 5. Alcohol use resulted in an increase in cigarette smoking and depression at all 5 time points, and alcohol use had an increasing effect on cigarette smoking over time. PTSD symptoms were not associated with smoking frequency at any time point. However, they were associated with an increase in depression symptoms at all 5 time points. So to conclude, results offer some clinical implications. So for example, these results strengthen the case for an integrated treatment approach that may include, for example, screening smokers or veterans with depression for other concerns such as stress, alcohol use, and PTSD, as these additional factors may be interfering with their smoking cessation goals or their progress with treatment for depression. And then I want to end by thanking my fellow lab members, Reagan and Daniel, who have helped me on this project. And I also want to thank my mentors, Dr. Peterson and Dr. Davis, who really supported me throughout my postdoctoral training. And thank you to you all for having me and also for your interest in this work.
Do we have questions?
Hi, Dr. Tran. Really good presentation, very sophisticated modeling, important topic. Just one thing I want to ask is if you can give your gauge of the effect sizes, because I know that you reported this was significantly associated with that, which helps. But if you could tell us a little bit just about ballpark effect sizes so we can gauge the clinical relevance of this important study, that would be helpful. Thank you.
Yeah, that's a great question. I'm just going to go back to, let's see. So I think it helps to have this in front. So I don't have the effect sizes in front of me, but what I can say is, like, for example, with this one, like stress had an increasing effect on smoking frequency over time. And so what that, like another way of thinking this is, like say, for example, like stress, yes, resulted in less cigarette smoking. I'm sorry, stress resulted in, less cigarette smoking at times 1 and 2, but over time we were seeing that effect increase. So over time, we could see that smoking resulted in increased cigarette smoking, and this effect increased at subsequent time points, if that makes sense. But yeah, that's a great question.
Thank you for your presentation. I'm Junhan Jo. Basically, based on this presentation and the previous presentation using the same data, so total you have 5 or 6 time points that you used. And then in that case, the first time points was assessed before COVID outbreak, right?
Mhm.
And then the remaining time points were assessed after COVID outbreak. So in that case, there would be some qualitative difference of your study variables between the first wave and the remaining waves, I think. And then in this case, your trajectories characteristics might be determined by the first 2 waves before and after COVID outbreak, or first 2 or 3 waves. So in that case, how you interpret your trajectory characteristics, such as slope or something?
I'm so sorry, I have trouble hearing you.
Oh, okay.
Is it possible? Yeah.
So because, for example, your trajectory slope can be determined by the difference between the first 2 waves, before and after COVID outbreak, right?
Yeah, time 1 was right
And
before the
time 1
outbreak.
and time 2, because in the previous and your study, I found very big difference in the across first 3 waves. So
Sorry, is this the slide you're referring to?
yes, I think so. In this case, you found very big difference across first 3 waves. And not in the remaining waves. So
Oh, for cigarette smoking?
for cigarette use. So in that case, definitely you will identify the decreasing patterns, decreasing trajectory of your cigarette use.
Mhm.
However, these characteristics might be determined by the first 3 waves, especially first time 1 and time 2 or something.
Yeah, I think I'm trying to listen or figure out your question because I can't hear you. But it sounds like you were talking about how at time 1 you can, and then times 2 and 3 you can see a big dip in cigarette smoking, and then it started to kind of level off at times 4 and 5, right? And maybe your question is what might be accounting for this, or what I think might be accounting for this.
Another approach to identify these trajectories.
Mhm.
For example, I think piecewise would not be good for this data. However, you can consider this time, the difference between time 1 and time 2 in your trajectory interpretation, I think.
Yeah, I think this is kind of related to your question, but we tested like differences between like the effects of like stress, for example, earlier, the effects of like across the different time points to see if it had like if the effects were similar across time or different. So I don't know if that's related to your question, but yeah. Thank you.
I think relatedly, Denise, I mean, what do you think about that big drop between, let's say, 1 and 2? Like, what could account for that? It's such a steep drop.
Yeah, that's a great question. In the general population, at least the literature that I was coming across suggested that that big drop could be because at that time there were a lot of fears that if you smoked, there was a good chance that you were going to contract COVID, one, but you were also going to contract the more serious form of COVID. And so I think a lot of this might have prompted a lot of individuals to change their or decrease their smoking, or to work on or at least increase their motivation to quit. So I think that accounted for that big drop too at that time.
Thank you, Denise.